Welcome. My name is Leslie Parkins, and I lead the Duke Civic Engagement Team in the Office of Durham and Community Affairs. I'm thrilled to have you all here for this Lunch and Learn session with the Community Engaged Scholarship Collaborative. These sessions are opportunities for scholars and partners from campus and the community to learn from one another and to share expertise and lessons of partnership and impact. The collaborative itself is a partnership with Duke Service Learning, Duke Faculty Right, Forum for Scholars and Publics, Social Science Research Institute, and the Clinical and Translational Sciences Institute's Community Engaged Research Initiative, as well as Duke Civic Engagement. And I want to acknowledge Liz Shapiro-Garza, who in addition to serving as an associate professor of the practice of environmental policy and management, is also the faculty director for Engaged Scholarship with Duke Civic Engagement. Liz will facilitate questions from following the presentation today. As we get started, we can have participants add your name and affiliation in the chat. And I'm delighted to have our presenters, Pilar Rocha-Goldberg and Rosa Gonzalez-Guarda, with us today to share more about their community academic partnership to address health and equity in the Latinx community. They both have a lot to offer us in our time together, and I'm going to take a moment to offer brief introductions. It was not easy to condense all of what they do into something brief, but I'll do my best. Pilar Rocha-Goldberg is the president and CEO of El Centro Hispano. Through her work, she provides direction and leadership and implements strategic goals and objectives for the organization. Pilar represents El Centro Hispano in the community and is an advocate for the Latina community. She's an active member on many boards, including the Chancellor's Health Advisory Board at Duke University and Durham Tech Community College's Board of Trustees, and that's just to name a few. With a degree in dietetics and nutrition, Pilar has worked at the Duke University Medical Center, where she developed and implemented programming for the Latinx community prior to her role with El Centro Hispano. Welcome, Pilar. And Rosa Gonzalez-Guarda is an associate professor and assistant dean at Duke School of Nursing. Through her research, she uses community engaged strategies to influence practice and policy changes to promote health equity for Latinos, survivors of intimate partner violence, and other historically marginalized populations. Rosa serves on local and national organizations, including serving as the chair of the board of directors for El Futuro, the Scientific Advisory Board of Esperanza United, and as a member of the executive team of Latin 19. She has interdisciplinary training in nursing, public health, and psychology. Welcome, Rosa. Thank you both for being here today. I'll hand it over to our presenters to share their stories of partnership and lessons learned along the way. And let's just make sure their presentation is pulled up as we're getting started.
Thank you, Leslie. It's always a little awkward to hear people introduce yourselves. So hopefully looking forward to having a conversation with you all around our relationship, the relationship between El Centro Hispano and Duke University, specifically the School of Nursing where I'm at, and some of our collaborative work doing this. Is everyone able to see here our presentation? Okay. Great. And because I think we're a pretty good sized group in terms of, not too many people on the call, I think it'd be good if people do have questions. We'd be happy to pause and answer them as we go along to make sure that we are able to spend some time addressing those issues. Let's see if I can move this here. Okay. So Pilar and I have no disclosures or conflict of interest to report out. On top of the many different sources of funding of El Centro Hispano, we are going to be sharing some of our collaborative work doing research, and we wanted to acknowledge these two funding sources that are part of that research. One of them is an R01 study that's funded through the National Institute on Minority Health and Health Disparities, and then we received additional funding through Duke University's COVID-19 Greatest Philanthropic Fund to do some work with community health workers during COVID-19 that we want to share with you all. So we want to talk a little bit about the evolution of the relationship between the School of Nursing at Duke and El Centro Hispano, share that history. We want to demonstrate a bit of how we've incorporated key principles of community engagement in this partnership, and then spend some time specifically operationalizing that as it took place in the collaborative research that we partnered on. And then we want to share from both of our perspectives some of the challenges and opportunities in doing this work. So before we do that, we're going to just dive in and share a little bit about what brings us to this work and a little bit of the history of our respective organizations. See that?
Thank you. Thank you for having us today to talk about this very important topic for our community in general, and especially for our Latina community. And how I got to El Centro and to do this work. So I came in 2004 from Colombia. And as you mentioned, I'm a nutritionist, is my background, and I came to work at Duke in research with hypertensive Latinos. So I was hired to do this work. I didn't know anybody here. I lived my whole life in Colombia. And when I got here to do the work, they gave me all the paperwork to read about the project they've been doing. With the DASH diet and this program with Caucasians and African Americans, and they knew the Latino community was also suffering of hypertension, and the community was growing, but they didn't know how to do this work. So they wanted to do this research study, and they told me, read everything and let us know how to do this research. With the community. So it was overwhelming at the beginning because, again, I didn't know anybody here. So I was Googling like everybody, and I found El Centro. And I was like, oh, El Centro Hispano, for sure they know, they can help me to learn more about the community and how to do this work with them. And when I got to El Centro, everybody was very excited. Finally, a nutritionist who speaks Spanish that can help us and talk to the community. So they were very excited, asked me to talk to different groups about basic nutrition, because obesity, diabetes, and hypertension is something that is really affecting our community. So I came to talk first to a group of around 25 women. I started with basic nutrition, and then I found out they were laughing, whispering to each other. And I asked, what is going on? I want to know. And they said, we don't understand anything you're saying, even though I was speaking Spanish. And with all this work, I learned that about all the diversity within the diversity we have in our community, how our immigration experiences and also age, educational level, economic level, all of that plays into knowing each other and communicating with each other and the issues we face as a community. So I started translating, bringing pictures, learning also about how the organization, El Centro, was a trusted organization, trusted place where the community come for whatever they need. Because even though my job wasn't really supporting any of these other things that weren't related with my study, yes, because I was there to talk about my study, I got really involved in other areas of the organization as a volunteer. But people saw me very often, and they started talking to me about their immigration experiences. So that's something that is, I think, unique for El Centro, because people sometimes come just because they need a place they can sit down and they feel comfortable. So then I started volunteering, being part of the board, trying to support the organization in fundraising, and decided I needed to do something else with the organization. So then the opportunity became to support the organization in structure and leadership. It was just an interim position for 6 months, and I've been there for 14 years. So that tells you how I love the work we do, and also the importance of organization in the community. And this picture I'll show you is it was such a unique thing to have a nutritionist who spoke Spanish at that time. We are talking 2004, 2005, that when I started coming to the organization, this is part of what we were doing with the study. The newspapers in Spanish were all over, and this is a translation of La Conexión, which is still around in the community. And they came, I also was in El Que Pasa, so I was like the famous nutritionist who spoke Spanish in Durham. So this is that picture from that time.
Thank you, Pilar. We're grateful that you stayed well beyond your interim position at El Centro Hispano. So just to share a little bit about my background and the lens that I bring to this work, I come to this work with a lot of gratitude. I was born here in the United States. I was born in a Cuban enclave, which is why I sound like I immigrated to the United States. People often ask me, where are you really from? And so my parents came from Cuba in the 1970s and moved into Miami and built a family in a part of town and a part of Florida where Latinos have actually a lot of power and a lot of privilege. And so I grew up in this community where I had the teachers that looked like me, politicians that looked like me, and I was actually part of a majority. I also had that experience of living the American dream. My parents developed a business when I was a kid, and I was able to see how their hard work, working hard for the business, was able to translate into social economic prosperity for me. So I remember very humble beginnings and my parents working very hard. I often was put, into the workforce as a family business, and I really saw them advance socioeconomically. And because of that, I was able to go throughout my life. I was able to start going to better schools. Our family started taking trips together. And so I really benefited from that experience of the American dream. And so I, grew up thinking that that was a possibility for everyone until I started to do mission work in the Dominican Republic and got the opportunity to work with Haitian migrants that were going to the Dominican Republic to work on sugarcane fields. Yeah. And in that work, I realized the important role that history, politics, racism, and social conditions have on health and well-being. And interestingly, in that experience, I had the opportunity to work with these sisters that were public health nurses. And I saw how their advocacy and their work to improve the social conditions of the Haitian migrants really improved their health condition. And that was really what drove me into nursing. So my immigration experience happened when I went to college and I went to Washington, D.C. And there I had the opportunity to first, realize that I'm part of a minoritized group and also have the opportunity to work with other Latino immigrant communities in other parts of the country where they don't have that same history and political clout, resources, etc. And so as a student, I benefited from a program that was really focused on getting underrepresented students involved in research. And I have, the first paper that I worked on was a study where we were looking at primary care control interventions for Latinos. And in that work, I was able to go to a federally qualified health center in Washington, D.C. that was serving the Latino community and learn a lot more about their experiences and their inequities. And so I realized at that point that I actually found these injustices more pronounced here in the United States because of just how many resources we have. And it was almost more appalling to me to see that play out in my own community. And so that's when I decided that I wanted to focus more on doing work here locally in the context of my own communities. And I continued my education in public health and public health nursing, really wanting to be someone that was boots on the ground, not really wanting to do research, seeing research as something that took you away from the community. But there was an experience that happened when I was a graduate student at Hopkins that really changed my mind about this. And it was that there was an outbreak of syphilis in the Latino community. And at that time, there wasn't many Spanish-speaking healthcare providers, nurses, physicians, public health people that really could connect with the community. And so I had this great opportunity as a student to be part of actually a CDC effort to identify and try to control the syphilis outbreak in the Latino community in Baltimore. And one of the things that was really eye-opening to me in this experience was that there wasn't much of a research or evidence based on what to do, because there wasn't a lot of work that was published out there. There was some good community work that had happened. And we worked with community leaders, but that work wasn't, that work wasn't widely available. And it was that really changed my mind about research and realizing that I need to have these skills and research to really best serve the community in the way that I wanted to serve them. So Pilar is now going to share a little bit about the history of El Centro Hispano.
Thank you, Rosa. Yeah, El Centro Hispano started like almost every nonprofit organization, and starts because the needs of the community. Yes, so in 1992, the systems in Durham were seeing these newcomers, these new people who didn't speak English, they were speaking Spanish. We were around 1% of the population in Durham. And at that time, Susan Gilbertson was opening the office of the Catholic and Episcopal churches in Durham. She speaks Spanish and she just came from Mexico. So she was getting all these calls from the health department, the Durham Public Schools, saying we need help with these community members. So she got together with a pastor from a church, and they started in the basement of a church, giving some ESL classes and supporting the community, and the community continued growing. Yes, right now we are around 14% of the population in Durham. So after some years, they decided we can't continue like this. We really need to open a nonprofit organization that can help the community and support it, always looking at blending service, education, leadership development, and community organizing, that we are still working on that, on all of that. As an example of the work we do is we look at the needs of the community, what is going on, and then decide if we can do need to do some of this work, or there is somebody else doing it and we can support that work. And one really good example is the Latino Community Credit Union. We were seeing a lot of robberies in our community. They weren't opening bank accounts because documentation and lack of trust in the system. So they were keeping the money in their pockets. On Fridays, they were getting robbed. They were getting into their apartments and getting into their savings. So El Centro Hispano got together with Self-Help and other credit unions and opened the Latino Credit Union, that now is a separate organization. They were only for 1 year within El Centro, and then now they have, I think, like 17 branches in the state. In 2002, we were seeing also other needs of the group of the community that is, we consider like minority within the minority, and is the LGBTQ community. Even within our own community, yes, the acceptance of these community members. So we started bringing people, supporting them, and we started with a basic group with LGBTQ community members, and right now we have 4 support groups for this community. We have transgender men, transgender women, gay and bisexual, and lesbian and bisexual community members, supporting groups for them. Then in 2010, our sister organization in Scarborough had to close their doors because funding and leadership, they came to us. We had some reserves, so our board of directors decided to open our second branch in Scarborough to support the community. In there, we were thinking we will just replicate some of the programs we know work for the community, but we found a new issue that we weren't seeing here that much. That was the day laborers. So in a corner, 40, 50 workers standing up waiting for work. So we became part of the task force at that time, and Later on, after some years, the task force that included community members, organizations, university, chamber of commerce, local government, police department, decided to open a worker center within El Centro Hispano in Scarborough. So we opened the Casa for Employment and Leadership, mainly connecting workers with employers and giving them a good place to wait to be picked up, but also to make sure they get paid, because wage debt was one of the biggest issues we were seeing, and also improving the skills of these workers so they can get better jobs and better paid, better quality of life. At this point, we were very well known for services, but we were advocating every day for the community, but we decided to be more intentional in changing policies and systems so we can improve the services for the community. And we decided to implement the community engagement and advocacy department to go more to the legislature and see what else do we need to do to support our community. And always we were having all these people coming, why did you open in Scarborough and not in Raleigh if there is more community members there? So it's not easy, as you can imagine, open an office and try to find the funding and maintaining the offices. But finally, with the support with one of our board members, we opened our third branch in Raleigh to serve Wake County. It was at the end of February, and then the pandemic came. So we really couldn't open the doors for the community, because one of the things that I want to highlight about our organization is that we are one of the only organizations that have like walk-in office for the community members for whatever they need. They can come Monday through Thursday, 9 to 5. But we couldn't do it during COVID. But then we were engaged in the COVID work from with the Department of Human and Health Services in the state. And they came to us to get support and get all the services for the community during the pandemic. And then when we were kind of in the middle in 2021, we implement also the advocacy and equity area for the organization. So being more intentional also about equity, diversity, equity, and inclusion, not only for outside, but as I mentioned, within our organization. We have now around 70 people working with us, and all of us come from different countries, different immigration experiences, education levels. So we are very, very intentional in the everyday work we do within our co-workers to make sure we are equitable, and we are really supporting them also in the work we do. And quickly, so now we are covering, yesterday we made the count, 11 counties in the state with the work we do with our 3 offices.
Incredible. So I'm not going to go into too much detail here, but a couple of colleagues and me recently published a paper that outlines our history of engagement at the School of Nursing at Duke, and it's with Irene Felsman and Rosa Solorzano, which many of you may know from their engagement work more broadly. And what you can see here is on the left, there's a snapshot of what the context for Latinos look like here in our region in Durham. And, you know, as Bilal mentioned, in 1992, El Centro Hispano was established. And you can see on the right hand is the different programs and activities that took place alongside what was happening historically here in our community. And what you'll see here is that our initial engagement with El Centro Hispano and also with the Latino community had to do around doing health fairs. We were working together in doing health fairs with Duke Health and the community to reach this population that, as many of you know, have really high rates of uninsurance. And we also then started working in collaboration with El Centro Hispano to offer Spanish language courses to healthcare providers. And we even had some of our faculty that were part of that programming at El Centro originally. Rosa was, I believe, involved in teaching some of that early on as part of El Centro staff. And then I came here to Duke in 2016, so a little over 6 years ago. And it was then that we started to integrate more the research mission of our organization into this work. And I highlight that because I think it was really important in that, I was building on a really long history of engagement with El Centro Hispano and the Latino community, so that when I came in with these ideas of how to integrate research within that work, I think there was a lot more openness to that because of this history of doing other kinds of activities together, service-oriented and education-oriented activities. And so I'm always very grateful to Irene and Rosa, who is the people that connected me with Pilar and El Centro Hispano. And I remember I came here in June and July. There was, already an event that I could participate in, a health fair, to really get to know this community. So before we share a little bit more about the research that we've done, Pilar and I wanted to start just sharing some of the values and principles that we bring to this work. And these are some pictures that we took a few months ago. I think it was November. We did a photo shoot at El Centro Hispano, and it captures some of our interactions there. And I think you all probably know all those principles and terms that we use around community engaged scholarship and community engaged research, and just wanted to bring some of those to light here. I think with the first picture that we see here of Rosa and Beatriz, there's just a lot of love really in our relationship. There's a lot of mutual respect and love and personal connection that we really enjoy when we get together. We have a fun time working together because of that. We recognize from the side of the academic side, and we'd love to hear Pilar's perspective on this, but from the side of the academic side, we recognize all the important work that El Centro Hispano is doing with the community. So we, as much as we can, try to minimize pulling them away from the important work that they're already engaged in, because we recognize that there's an opportunity cost to that, right? So if we ask people to come to visit us at Duke, you all know how difficult that is with, pulling you away from where you're at, and also, the parking and navigating directions and all of that. So we regularly come and meet with Pilar, and when we do that, it's not only about the research, we try to connect on the other aspects of work that we do. So we take advantage and connect on if we're planning a health fair, or if there's other opportunities with students that we're engaged in. We try to kind of connect all those circles that we have in academic, the service, the education, and the research circles together in this partnership. You'll see here that there's some pictures of the promotoras. These are the ladies in with the green shirts are people that are from the community health department. Is that right? Is that the community health department, and their community health workers or promotoras that we've had the opportunity to work with very closely. And they've taught us a lot. And so there's a picture there showing that they're teaching us, about their experiences and what they think needs to be done to address some of the issues that they're seeing in the community. And then there's some times that they ask us for things that we are able to respond and teach them. So it's a very mutually beneficial relationship in where there's this bidirectional learning that occurs. One of the people in our team that's on the Duke side has some expertise in doing motivational interviewing, and so has done training with the promotoras on motivational interviewing, and they've been very successful in doing that work. Pilar, what do you want to add here?
No, I think what you said is very important, that we value really our relationship, and it's not only one side. Yes, it's both sides. And I think is why we've been successful with this relationship with Rosa and the team, even before, because there is that knowledge and respect of that relationship. And I think that's very important. And knowing the culture also of the organization, because it's a very, I'm part of different boards, different, have different relationships, and I see, the nonprofit is a different world from the academic, from the corporation world, and even the Latino nonprofit world is different from the regular nonprofit world. And I think El Centro also is like all these mix. And I think that's important for people to know when they come to work with us.
Yeah. Yeah, I think another really benefit, I don't know if it's a value or a benefit, but there's some students that are like I have a PhD student here in one of these pictures, and she actually felt very disconnected from Duke and very disconnected from academia in general until she started working with our research team. And it's not, and it's not because of the academic partners in the team. It's really her opportunity to connect with community members and feel like she's home. That really changed her mind around it. So this student started as a graduate student, and then she decided to get her PhD, and she's in her last year right now, getting ready to defend her dissertation. So there's just so many incredible benefits from this work. So now just to tell you a little bit about our study, and I'm going to focus a little bit about the context and how we have operationalized principles of community engagement into the partnership rather than the data. So if at some point you're interested in seeing some of the results, I'm happy to share some of our papers and share more of that at another time. But just so you see here, Pilar is part of the investigative team, and so she's a co-investigator on the project and was very involved in terms of developing ideas and really bringing the Centro team on here. We also have members on the team that really span the whole spectrum from the community to the bench. Part of this study is looking at how experiences of acculturative stress get under the skin and contributed to health inequity. So we have, like on one end, a bench scientist, Julia Walker, that is helping us with all the biomarkers. And then on the other end of the spectrum, that translation spectrum, we have people that are very much involved in leading initiatives in the community, such as Pilar, and also other faculty members that are more community-based, such as Irene. And our team, our members of the team, have people that are from Duke and people that are from El Centro Hispano. So part of the budget is to support the members of the staff of El Centro Hispano to be part of the research team. And many times when we're in the community, people don't know, are you from El Centro, or are you from Duke? They see this, they see us as a team and are often not able to differentiate who's from where. So as I mentioned briefly, this study is looking at really how the experience of acculturative stress, the stress associated with adapting to a new context, to being a Latino immigrant in the United States, and specifically here in North Carolina, how that influences a number of stress responses. And we look at these stress responses from a syndemic perspective, and I'll share what that is in a minute. But you can see here that we're looking at a number of behavioral and mental health outcomes, as well as some biomarker outcomes that are associated with stress, to really get an understanding of how over time, how this experience of acculturation and acculturative stress really influences health outcomes. And more importantly, is understanding and recognizing that our community brings an incredible amount of resilience with them. Actually, when they first get here, we know that they're healthier than US born individuals, but that there's a decay in that health over time. And so our team is really interested in understanding what is protective that Latino immigrants bring with them, and how we can maintain that over time during this experience of acculturative stress. So just to tell you a little bit about the syndemic outcome, syndemics are co-occurring epidemics that cluster in historically marginalized populations. And so the idea with a syndemic is that these are conditions that have common causes or common links, And our team is trying to understand what are those common links so that we can develop intervention strategies to address those links. And I want to show you this picture because this is a picture that the promotoras from el Centro Hispano helped us revise. We were looking at the roots as like, what are the root causes of the problem? So we had bad things under there. And they helped us realize like, no, the roots actually are the resilience. And this is something that really resonates with the narratives of our community, saying that they feel uprooted here in the United States, where they're not able to really plant and exercise some of the things that are healthiest for them, such as, strong family and community support, their pride around their culture, etc. And it's really the environment that they live in that is a risk. The environment of experiencing a culture of stress, being discriminated against, trying to access services and systems that are not built for inclusion. And that really is the context, the thunder, the wind that is challenging this tree, but that context is also an opportunity for the roots to deepen and to strengthen. And we know that happens naturally to trees amidst these environmental exposures. So, of course, you saw the COVID-19. I think we're so tired of seeing that. But of course, it wasn't a surprise when COVID came that we also saw inequities in the Latino community around COVID. And it's within this endemic perspective that it helps us make sense of, these existing vulnerabilities that really shed light to inequities that happened during COVID. So that was just one additional thing that happened that we added to the work that we were doing in this research study in this collaborative between el Centro Hispano and Duke University School of Nursing. So our study right now is complete. We're in the process of doing data analysis, but we wanted to share some of the things that we did in terms of operationalizing the community engagement strategies. And so the first thing I think is something hopefully Pilar and I have helped identify, which is this idea that the engagement between our organizations and the community, the Latino community, was early and often before initiating this research study and then beyond this research study. So for example, I got to meet the promotoras from el Centro Hispano for the first time at a vaccination event where we were both working together at. And it was awesome to be able to meet them in person, because at that point, we were working together on Zoom. And it just that, just so happened that we were both worried about these inequities in COVID-19. We were all, both organizations wanted to be part of the solution around addressing some of those inequities. And we were working together to beyond the research that we were doing to address that. And we did a lot of that work through the work of Latin 19, which many of you know about. The other thing that was a really key thing too was that we had, as I mentioned earlier, people on the research team that were staff at el Centro Hispano and were very connected and were from the community. And they were really critical in terms of helping us design this research in a way that aligned with the principles and priorities and realities of the participants. And then also engendering that trust of our team to be trustworthy sources of our people to interact with as part of a research context. Another strategy that we used that I thought was very important is that we were very thoughtful about having strategies to disseminate our findings with the community and also bring together people that were providing services around some of those findings. So every year we have a Access for Immigrant event, and it's more of a community event where we would invite our research participants, we'd share some of our findings, and then we would try to connect people with services that were needed. So for example, one of the syndemic conditions that we find that is most common is intimate partner violence. And so we would make sure to have different groups that were addressing that issue be part of these Access for Immigrant events to be part of that. And I'll stop there to see, Pilar, if you wanted to add anything here.
No, I think you said everything very well.
This is just, an example of the promotional materials from our most recent Access for Immigrant event that we did in partnership with a Latin 19 meeting that we were able to extend. And one of the things that I really liked about this one in particular is that we invited people to share spoken word around their immigration experiences. And I remember having to welcome people after people shared the spoken word and feeling like, oh, there's actually there's no more data to share that would communicate our findings better than what these artists did through sharing the spoken word, and made me think of myself being more thoughtful about bringing in the arts to be able to engage people and communicate messages around that. So during the time we were learning all this, the original study was just an observational study where we were learning what might be some important targets for intervention. And we learned that, there's specific types of acculturative stress, particularly related to the family, that were being very harmful in terms of predicting these outcomes. And we also learned that there are some resilience factors that were very protective, like maintaining strong family bonds, being proud of your culture, and coping in positive ways. And so we, during the pandemic, had the opportunity to get some funding to work with 10 of the Centro Hispano promotoras, and you can see them here, to co-develop a intervention to address what we were finding within the context of the work that they were already doing to address COVID-19. So what we did is we worked with the promotoras, and we did design thinking workshops with them, where we developed together intervention strategies for them to use while they were doing work addressing COVID-19 to address acculturative stress and to promote resilience. We did some training with the community health workers in motivational interviewing, and we had them go through the training they designed with us and give some feedback on how that could be improved. And we did a pilot test with some of the participants that had already finished data collection, and we actually found that we had some really positive impacts on reducing acculturative stress, improving COVID risk, or reducing COVID risk behaviors, and decreasing depressive symptoms. The people really liked, they also really enjoyed having this opportunity to connect with other people and learn from their experiences as well. And so, this project that we did, was really focused on working with communities and with families in helping them buffer against this stress that they're experiencing and develop some positive coping skills around that. But we recognize that there's some problems in the system that we have to address. And I think that's the biggest challenge for our partnership, I think, in the next, 5 to 10 years, is for us to continue to work with families, but then build on those strategies to develop interventions for the systems themselves to make them less stressful and to make them more inclusive for the Latino community here. And so it's really exciting. Hopefully some of you all have heard about this opportunity, but the NIH has this new initiative that is the Compass Initiative, and it's really around supporting community-driven research and community-driven structural interventions to address health equity. And so El Centro Hispano now is serving as Pilar is the PI of this project, and they'll be leading a intervention. Hopefully it gets funded. So we'll keep our fingers crossed for that. But what they're doing is they're gonna build off the incredible work their community health workers have done to test the role that community health workers play as a structural intervention in improving, in being at advocacy tables and improving and changing policies so that they're ultimately more inclusive and equitable for the Latino community. Pilar, did you want to share anything about this opportunity?
No, I think we didn't think twice to call Rosa to support us in this initiative, and we'll see. Hopefully we get funded, because I think, as I mentioned before, if we don't change policies and systems, and as Rosa was saying, it's going to be the same for our community. Yes, the same barriers, the systems are not ready. At least now we appear in some of the statistics, and I guess COVID helped with some of it, but definitely we need to work in changing systems and policies.
Yeah, and I think that this kind of mechanism from NIH is really going to change the whole research landscape, because here the academics weren't allowed to be, not even like multiple PIs or PIs, that were part of the research team, but it really is supposed to be research that's led by the community and the community organization. So I'm just really excited about this new opportunity. So Pilar is going to share a little bit about her perspectives around challenges and opportunities in this work.
Yeah, thank you. One of the things I learned early when I started doing my work at Duke, and also supporting El Centro as a part of the board member, was that people felt, what are you doing here if you work at Duke, if you're a Dookie? Yes, because they feel, they see the academic world really far away. And part of what I try to do, and I did, and I think we are evolving in this, is again, for the academics to understand the work we do, as I was saying, as an organization, and understand how we operate, because people see, we have, believe me, a lot of researchers and other people coming to us saying, help us to do this outreach to the community, to get the community engaged. And we receive a lot of the times, it's like, oh, it's simple. It's just putting this flyer out there. It's just telling people simple things like that. And it's not as simple as that. And as I was talking, trust from the community in the organization and the people we work with. And also we want to make sure that when we work with somebody, that work really benefits the community. Yes, impact the community in a positive way. It's not just also saying, oh yeah, let's do this for this money. And then, because that's our mission, yes, to make sure our community gets what they need to get in the manner they need to get it. So those are the things that I think are very important, but still, even though we have good relationships with some researchers, and in this case we are showing, the majority come to us not understanding this part and not respecting this part, and the knowledge we have and the trust we have, just for people to saying, you know, we El Centro Hispano is here, people will engage better from the community, but we are still trying to overcome that and be stronger about voicing it and say, no, we won't be able to support you unless you support our organization, learn from us, respect our culture, but also support our staff. And as Rosa was mentioning, not just economically paying for staff time, but also capacity building, because that's some parts, yes, trainings, evaluation, all those pieces that we need as an organization. And there are a lot of ways that we can evolve in this work, and we can continue participation. And again, as I said, is how we are giving something, but also how you can give to us and to our staff, mainly to our organization, is the only way. As I said, we are now 70 people. 30 of those 70 people are community health workers, people we hire from the community. Some of them were users of our services, and we've been training them to be able to be certified by the state. But of course, as you can imagine, we have to do a lot of trainings, and we don't have all the capacity. But thanks to some of the partners we have, and here Rosa's team have played a big role in this, is how you can help us with that capacity building, and supporting the organization in many different ways.
So just to add some of the challenges and opportunities from academic partner perspective, and I know many of you have shared some of these challenges with me, and so we'd love to hear about your thoughts about opportunities for improvement during our discussion. So as many of you know that are academics, we know that community engagement is not always applauded, and I've been even surprised in terms of how that has even manifested during the COVID-19 pandemic, because in our community, we did see just really atrocious inequities. And, you know, I personally left a lot of my own research to do more active, more public health nursing kinds of activities from wearing that hat. And you know, that's something that wasn't necessarily applauded in a way that yields, you know, advancement from a tenure appointment and promotion perspective, or a recognition of how effort needs to be accommodated to allow and support faculty that are engaged in that kind of work. We also know that there's just a myriad of different structural and administrative barriers. In the communities that we work with, we have a lot of barriers around payment of partners as well as payment of participants. And particularly this is true for individuals that we are such an important part of our community, but may not have a social security number or tax ID number. And so that is really difficult for us to navigate. We figured out some strategies around that are just workarounds, but they're workarounds and they require additional investment and time and frustration with that. The other thing that's major is that, and this is a structural issue, is just the inequities that exist around indirect rates. So as a, you know, even if we're trying to plan a budget where we're equally distributing funding across community and academic partners, there's this inequity in the financial structure around these negotiated indirect rates that does provide more support for the infrastructure in an academic institution versus a community institution, where they probably need more support for this work that they're doing, that's beyond, a little bit beyond their original mission for the organization. So I do think that there's lots of opportunities for us. And one of the things that I continue to be excited about and is this idea of investing in programs that allow academic partners to be in residence in community organization to support some of the other needs around capacity building, as Pilar mentioned, evaluation, et cetera, that is not often always funded from a research perspective, but it does involve research expertise in bringing to that. So I think those are opportunities for us to improve that and to support faculty that are involved in this work or want to be involved in this work. And then, you know, essentially, I know that this is part of what this group is trying to do, is really thinking about the infrastructure at Duke that will facilitate and make engagement easier. Just part of the culture here, and not something different when we think about research. So just to wrap up here and open it up, just to let you know what is works in progress for us. We have a couple of research applications that are being reviewed right now that we're waiting to hear back on. One of them is trying to expand our measurement around Hispanic stress or culture distress to include children. And we have very good measures with adults and adolescents, and we know that families are really important to work with. And so we're trying to develop that for children. The intervention that the promotoras and our team work together to develop, we're trying to get funding to do a larger scale community trial on that. And so that's Sed Familia. We have that under review as well. And then we're excited to hear back soon, hopefully, around this community-driven structural intervention that Centro Panel will be leading, and we'll be supporting around testing community health workers as a structural intervention. So a lot of thank you to our research team here, and I'll stop sharing and we can open it up for any questions people have.
Hi. And Pilar, thank you so much. I really am so appreciative of all that you've shared. It really does help us, I think, understand in a very profound way some of the costs and benefits and challenges and opportunities that exist for community university partnerships. So we're moving now into a Q&A with our audience, and we have a lot of really wonderful people with incredible backgrounds in our audience. So I'm hoping that we get some good questions from you all. If you want to put those questions in the chat, you can. You can also use the raise hand function if you do have a question, and I'll call on you that way. I'm going to go ahead and start while people are thinking about their questions. So Pilar, I had a question for you, actually. I know you talked about some of the costs and opportunities of engaging with researchers or with other folks at Duke as well. Can you, and one of the things that really stood out for me was your observation that you get approached a lot, which makes sense because you are have been around for 30 years and are very much so active in such a face of the Latinx community, I think in Durham and beyond. But how would you recommend that people from Duke or otherwise or researchers do try to connect with, say, El Centro Hispano and the communities that you work with and represent? What would you recommend?
Yeah, no, thank you. Yeah, I think people start changing their minds before they approach us, because the way they approach us, and right now we are even changing part of our structure and having one person responding to these researchers coming to us, so we can analyze is something that we can really do, we can commit to this, how these fit into our departments, our programs, and into the work we do in our mission. But starting from that, yes, so just they can send an email, they can call us, they can say, okay, we have this idea, or we are working in this research study, and we want to include the community, can we have the conversation? Instead of coming, oh, we are having this, I'm sorry, my dog is asking. We have this research study, and we included that we are, including Latinos, and we need your help reaching out, and here is the flyer. And we get a lot of those, believe me. So then you get like, oh, it's a little late for us, we can't do it that way. But if we have the conversation, even if you already have the research study and you need to get into the community and talk to or recruit community members, if you open up the conversation, we can see, okay, yes, it's something we can help you with, and this is what we need, or this is how we can do it. Not always, again, it's about money or including in the budget, but it's how we can really work together. So I think it's building that relationship. And something I wanted to mention that I think want to emphasize, and I learned through my research when I did it at Duke, is presenting the findings to the community. And I know also since that time I was working, Duke was looking at how to translate that research into services that I was able to do with my research study. We have now the program Salud Integral, which is based on that. But I think that's those two pieces, letting people know, okay, we came, we asked you, we did this, these are the results, because then people don't feel, oh, they come to ask me, I'm tired of this. Yes, this is what I got when I got here to do my research.
Thank you for those observations, Pilar. I think that's something that it really is helpful for all of us to hear. So thank you. I am not seeing questions from the audience, although I'm just going to encourage you, step up. Yeah, I know you have questions. Please feel free to put them in the chat or raise your hand. I'm going to ask another question of you both, though, too. Rosa, what I really appreciated your discussion of the ways in which it's important for researchers to engage with communities and community-based organizations in ways that are very holistic. So thinking not just about the research aspect, but also other things that we can offer that can support the work that's being done. But the question is actually really about the research. In what ways do you feel that research itself can support community-based organizations or marginalized communities more broadly? And again, that question is for you both, but I'll let Rosa start.
So I think that I think the Compass opportunity is just one example of that. And it's that we were able to use some of the findings from the research and some of the preliminary work to support an application that was like not only responsive to what we found in the community, but also B, demonstrates the leadership that Centro Hispano has had in this space with some data to support that. And that could be, they convincing and helping that organization continue to do that work and receive recognition for that work.
Thank you. Pilar, did you want to add?
No, no, I think I've said
Okay.
full times, yeah.
It was fun. That working together on that application was fun because one of the people on the Centro team were trying to encourage us to, hey, let's use our own data. Like, remember that Pilar has published studies, and remember that we have the Centro Hispano data. Like, let's use our own data. We're so used to saying, okay, this is a problem, and these people said this. And then she was just very adamant of reminding us, let's share our own work in this narrative to make the case.
Thank you for that. Joan, I'll let you ask your question as well.
Thank you. It's a pleasure to hear more details about your work. I greatly applaud all of your efforts in the many realms of work that you do, not only the research. My question actually is perhaps taking us off the path a little bit, but since I work with undergraduates at Duke, I feel that it would be interesting to hear from you about how you see the experience of getting undergraduates, so non-professionals, involved in the research process. Obviously, we want to be very thoughtful and very ethical in how we engage students in learning about the research process. But do you have recommendations, or do you have like stages in your research protocols that might be appropriate for students to learn? Because one of our goals is really to prepare these students to then be able to really take on these community-based participatory research projects as they move out into their careers.
So I think that I'll start, and then I would love to hear Pilar's perspective about like students coming in and out, from her perspective. So we have worked with a lot of undergraduate students, and that they've been awesome. Our Duke students are great, and we were able to get a Basque Connections grant, and we had two of our postdocs that were on the team, and this is Allison and Gabby, who are now faculty members. They worked with Irene, another member on our team. They led this Basque Connections, and what they did was they tried to integrate some new aims around the political climate, trying to understand how the political climate was influencing the experiences of acculturative stress that we were already documenting in our study. And so they worked with part of the Centro Hispano team, who was the lead of the policy arm that left, and I forgot his name, Pilar. But anyways, there was a point person from yes, Elias, from a Centro Hispano that were actually working with the students as well. And so that, they had some meaningful engagement, of course, like not as long as the rest of the people on the team that were here for a longer period of time, but they were able to integrate some additional data into the team, and even we're able to lead some papers and get some presentations. And they, they learned a lot about the principles of engagement and how they saw it, even from attending our team meetings, right? And being able to see our interactions in the way that we worked together collaboratively in that. So I think it's very important and it's helpful. Our team has used kind of like this nested mentoring model where we've had a lot of our junior faculty mentoring undergraduate students that are being mentored by more senior people on our team. So that really seems to work well.
Yes, and I think we've had throughout the year some students coming to support some, or they have to do like a small short project, kind of no big research, but and it depends of course the group of students, how motivated they are, but almost always what we ask from them is help us with something that we already have going on. Yes, no, with something new they are bringing, because it's more difficult for us, and also because it's a short period of time. So we don't have time to, let's think, let's put this program together. But almost always our experience have been good, but it depends a lot on the students. But I think, and we are open always to do that.
Thank you so much for those perspectives. Thanks to Joan for the question. We have time for one more question. There's a question from Chioma in the chat, and I think I'm going to go ahead and call on Anne because you were first, but Chioma, I do see your question as well.
Hi there. First of all, thank you so much. This was such an amazing presentation, and I actually have about 12 questions, but I'm going to leave it to, I'm about to embark on interventions with teenagers at risk of academic problems in the Durham public schools and also surrounding counties. And I don't have measures of acculturative stress. And so that would be a question maybe to shoot you an email and get some additional questions, because we want to kind of collect that kind of information about the teenagers. And of course, I have so many others, how to train our undergrads that go out and facilitate to be more culturally sensitive and involved. And I'm affiliated also with psychology here at Duke, and interested in having a first-year clinical psychology internship, because the first years don't get out in the community at all. So many ways that we can connect, and I think maybe we need to do a lunch.
An in-person lunch.
Yes. But just to ask about the measures, and I think I can go back and forth with you about that.
Yeah, definitely. We have good measures for acculturative stress in adolescents.
Thank you. I think there is one more question that I will ask, and then I think we need to end. But Chioma says, based on what I learned from my program here at Duke, I know it's hard for researchers and community workers to come together to make a research study successful, but also making sure the community experience this positive impact. In your work so far, what are 2 or 3 key things you noticed that help community workers and researchers work well together? Pilar, do you want to start?
Yeah, I can start. I think definitely, as we mentioned, making the relationship, not just at the level of, I need this research study or whatever, but again, understanding each other, from us to learn more about why are you doing it, how are you doing it, and for you to understand the culture of the organization. And then we can go from there, working together, instead of coming and saying, this is what we need, this is how to do it. So I think that makes it successful, and also for the community. And if you're coming to an organization that is trusted in the community, for sure you can have that engagement and that positive impact in the community.
Rosa, did you want to add?
Yeah, I think it is, like Pilar said, it's all about relationships and being authentic in those relationships. And I think that it's around investment. And from the perspective of the academic partner, it's important to recognize that like any relationship, you need to invest in that relationship. And so part of that investment is time. It's thinking about what resources you have that you can share and can, contribute to the work that's happening in that organization. And it's also, creating structures to make sure to feed that relationship. So for example, I think a really important part of this is that really thinking about, the effort that you can be able to support through whether it's like pilot funding or startup funds or something that to support the time and effort that our community partners are giving in terms of that relationship, right? And part of our academic roles, we have some of that structure already embedded. Like our time is to support research and relationship building is part of that, but that doesn't exist always in community partners support systems. So thinking about ways that we can try to support that relationship building part of it, I think is really important.
Thank you so much for those insights. And thank you all for your questions as well. I'm sorry that we didn't get to yours, Michelle, but I know that you have put a link in the chat. So thank you so much, Rosa and Pilar, for joining us today, for sharing your insights and your wisdom and your deep experience in community engaged scholarship. And in this, and I think it, as you both have noticed, or both have told us today, it goes well beyond just a partnership for research, but deep engagement and relationship and love. And I am so appreciative to be able to learn from you all. I am going to put a very quick link to a very quick survey in the chat so that you can all provide us some feedback on the session today. I'm also going to put a link to upcoming events for the Community Engaged Scholarship Collaborative. We have a number of upcoming both lunch and learn sessions and workshops in Community Engaged Scholarship. So we hope that you will be able to join us for those as well. Again, thank you so much for joining us, all of you, and for taking the time today during your lunch hour.
Thank you. Thank you for the opportunity.
Thank you.